What? Okay, do y'all know where to place topical anesthetic when you're numbing a patient? Yeah, on the gum. Where at on the gum?
By the root. I mean, by the what it keeps on.
Okay, your nerves on the maxillary go down like this. Have y'all seen the pictures in the book? They go down. So if you're doing an anterior, a maxillary, it's going to go by the tooth that you're working on. So you place it here. I always go, if I'm doing number 6, I'm going to go 5, 6, and 7. I'm going to place it here. Okay, that's where it's like. If you're doing a mandibular, the nerves go like this. Okay, so if you have the midline right here, and you're doing any teeth here, you're still going to get numb back here, and it goes all the way around, and it numbs to the midline. And your tongue gets real fat. Y'all have been numb before, right? So if I'm doing, like, even doing number, what tooth number is that? Do, 29. Because that's 30, 31, 32. What model you in? Third. You learned the teeth numbers.
Could you go ahead? Yeah, I know.
Okay. But when that doctor goes, that tooth number.
You gotta get out.
Yeah. Okay. So that's 29. So you numb all the way out here. And that's why people's lips are just like hanging down like this. Because it's numb out to the middle. So it gets numb here if we're doing even this tooth. Occasionally you come back and numb this tooth around the tooth. It's not numb enough. Okay. So we're going to place the topical. And this is topical. We place it here. I don't like to take my 2x2 and lay it on it because it soaks it all up. It's supposed to be on the gum. It's numbing the gum, the mucosa. I always put it here because you have lips here, and that'll hold that in place. Oh, he bit me. He bit me. Did you get that on tape? Right. I just lay it right there. Now, we're numb. The doctor comes in. Hey, Bob, what are you doing here today? Let's see what's going on. He looks in there. He sees it big bombed out with decay. He looks on the x-ray. You have it written over here. We're going to look on the schedule just to make sure we're doing the right tooth. Because what if you put your x-rays up there backwards? Okay, and it's really number 20 we're supposed to be doing. Okay, that's why we're going to make sure our x-rays are up there correctly. And everything corresponds with that tooth number. It's got decay in it, I can see it, so I'm good, Molly. Okay, so we do this, and it's okay if the doctor takes it and just tosses it over there, or he may hand it to you. Now, fulcrum. Okay, now, you see, I want you to come with that hand, and I want you to lay it right in my fingers, just like that. Cap off. Cap it. He's going to come over here. He's always going to look behind him. The dentist is going to look behind him to make sure nobody's back there, and he's going to bump them and stick you or stick the patient. They're always going to be like that. You watch it. Bevel up, that little hole right there, bevel up, so that point actually penetrates the skin. And when you get good, that's how you're going to pass it. There you go. Bevel up, and that's how you pass it. But once you start doing that, that dentist is going to expect you to do it every time. So if you don't want to start it, just don't even look at it. Just hand it. But you want to hand it to where it goes in their fingers and thumbs. We're going to inject them. Y'all have had this class about the syringes and all?
No.
Okay. This is called an aspirating syringe. And what that means is, y'all know what it means to aspirate something?
Like come out.
Yeah. So, I aspirated a big piece of meat. Okay? So, if I don't get it out, it's going to go where? In my lungs. I aspirated.
Sucked it up?
In my lungs, not my stomach. It went down not my esophagus, but what?
Your throat.
It went.
Yeah, okay. It went in my lungs. Okay? This is an aspirating syringe because, look, I'm going to pull back on this ring. And the reason I pull back, watch this. When I pull back, what do y'all see?
Nothing.
bubbles. Okay, I'm gonna pull back on it just to make sure that I didn't stick a vein instead of the nerve, because I don't want to give this anesthesia in the vein. So I'll stick it and then I pull back to make sure no blood goes in there. If blood goes in there like a little stream, then I'm gonna take it out, reposition it, aspirate again. And if there's no blood now, then I'm going to numb them. And if there's blood in there from the first time, it's okay. It's their blood. It's going back in their body. It will be resorted. Okay? So once I get done, I get right here, get my fulcrum. Why don't you take this from me? No. Lay it up here. You're going to do it. Take this hand. You're going to go just like this. You're going to lift it up off of my thumb, and you're going to put it in that recapper. There you go. See, you always want to sneak it around like this, the patient, so they can't see it. Here, I can't see nothing. If I go like that and go, ah, you freak out. So you want to sneak it around like a snake, so they can't see it. You have to friend me so I can see this on. You can put this on Facebook. Is this live?
No.
I've never been on Facebook Live. Oh my gosh! Wait.
Girl, your patient is dead. You just put them. You just numb their mouth up. Hit the mag.
I'm on live. Hold up.
She had a mirror.
Okay. So they're numb. We're ready to go. Now I'm gonna look at these. I know you're ready. Okay, I'm gonna look, see. Okay, y'all listen up. Now, watch how I take these together. Okay, I'm gonna give these back to you. And you can just take these with you.
Well, I thought we were practicing.
We're not passing yet. We got a drill. You ready? All right. When I go to reach for my handpiece, you automatically get peanut butter and jelly. Right there. There you go, together. So when we come back, we're ready to go. Okay? Using the glasses. Does anybody have a pair of goggles she can put on here? Because this is now on fire.
I have my glasses.
Can she just borrow them?
Are they goggles?
I'm going to be taking out old silver filling, and that stuff has a tendency to go bing, bing, bing. So, this handpiece here is a high-speed handpiece, and this particular burr that I have on there is called a 557. Okay. 557. When I was at UAB, when my husband was at UAB, he my sister and I was out back. I had to go smoke anyway. We're in her car, and I'm sitting here in the passenger. She's at the driver, and all of a sudden, the windows were down. All of a sudden, I heard this little ruffling noise over here, and I looked, and it was this white guy. And he comes out like this. He goes, "I'm not going to hurt you. I'm not going to hurt you." And I reached down the side of her car. There's no gun in there. Okay. I said, "I got a gun." "I'm sorry." He backed all the way up. Boy, we rolled them windows up. The doors were locked. But what made me think to say that I got a gun? I have no idea. But that was the first thing that came to my mind. Because I got a gun. I got a gun. Yeah. I'm like this, you know. He goes, "I'm going to hurt you. Hurt you." He just backed off. Scared the poop out of me. All right.
You're in charge.
Where are you going? Okay. Come on. Okay.
She did it quick.
Okay. All right, so. All right, ready? I'm taking out this old silver filling. pretty. Okay, immediately a piece went flying back in the roof in the pallet. Okay, immediately. You got your eyes on it, you go get it. And you go, got it. The doctor shouldn't have to go, did you get it? Did you get it? Where'd it go? Just say, got it. And he can continue or she can continue working. Okay, so I got that out. Now I want you to rinse it and dry it. I'm going to come back with my slow speed because we're getting close to the nerve and I don't want that high speed generating that heat. So I'm going to go in there slow with it. Dry that out. All right, you're going to hear something. Hear that? Y'all remember that? Dennis? Okay, let me show you a trick. If you'll take this and put it in your little finger, that way you can reach over and get that. And hold it here.
Cal, you gotta got this video on time.
And then put it back in your hand, and grab a 2x6. Because if I'm scooping out decay, I want somebody right there to wipe that off. The first time y'all see mushy decay coming out of this tooth, you're gonna go, oh my god, that's disgusting. Of course, you got a mask on, they can't tell what you're. Just watch your eyes; they don't know. Okay, just keep your eyes still. You can go.
Your eyebrows too.
They can't see your mouth expression. But the first time you see that, it's gonna. Oh my god. Okay, so the spoon excavator is gonna scoop out any decay there. I'm not gonna move my fulcrum. I just reach over and pivot. That's called pivot. Okay, so that's good. I'm done. I'm just gonna flip it and you just take it. Okay. Now we're ready to put our dical in. Does anybody know what dical is? It's calcium hydroxide. Okay, and what that does is helps promote secondary dentin, new dentin to grow. The dentin is real thin right there over that pulp. Okay? Now, let me show you a trick. Instead of trying to hold your placer, pick that up for me. Dical placer. It's okay to go ahead and give this to the doctor like this, so the doctor is just sitting there waiting while you're mixing. That way you don't have to lay your spatula down and then pick this up and pass it. Just go ahead and give that to me, mix it, and then bring it to me. It's a little lining that goes over top of the pulp. Okay. We're going to put that on before we get ready to put the fill in. Okay, who's leaving around? See it's on that little ball with the little placers like that? That little ball on the tip of this thing allows it to actually go like that and you can move it around and cover that pulp. Okay, like that. Now, don't move. I want to show you another way of doing this. Some doctors like it like that, and some doctors like it like this. You've mixed it on your pad. They're holding that. You can bring it over like this, up on its side. Okay, you see that? And then just run your, can y'all see that? And then run the dical placer through it. That way it gives you something to push up against. Okay, you go like that, you get it over here, and you get it up there. You just wipe it up against it. See how it fills it up? So whatever your doctor likes, the way she passed it, you can go like that and get it up on the tip, like that, and pass it, or they like it, whatever they do. There's different ways of doing it. Okay? So they're all correct. See how much is on that? Wipe that off and then wipe this off. Did you see how little she put on here? She did an excellent amount of. You have a base and a catalyst. It's called a two-paste system, not toothpaste. Two-paste system. Base and a catalyst. This is the base. Right. That's the base and that's the catalyst. You mix it equal amounts together. Now it's already set up. Okay. But you don't use a lot. Do you see how much I put in there? Because that area, I do on this last month. That area across that top of that pulp is not very wide at all. And this is a premolar, so it's really not wide at all. Y'all know the difference between a direct pulp cap and an indirect pulp cap? And an indirect pulp cap. I went over that in y'all's class, didn't I? Anybody know? Anybody else know? Okay. What I did, which somebody say on here.
Heather started saying it.
Oh, what was it?
It's like one of these phones, and then one of
Can y'all see my little diagram right here? I put that calcium hydroxide right over there on top of that pulp inside. If that decay was close to that pulp but not into the pulp, the nerve, then I'm going to put calcium hydroxide in there, and that's called an indirect pulp cap. In other words, I put a cap over top of that pulp indirectly, didn't go into the pulp. Okay? If it goes into that pulp just a little bit, the decay, I would put calcium hydroxide across there, say a little prayer, sprinkle a little water over and say a prayer. That's the sprinkling of the water. Anyway, I'm just playing. But that's called a direct pulp cap. Okay, and that patient could, if it didn't build up more dentin in here, it could cause a problem, and they may have to have a root canal treatment on it at a later date. So the doctor would say, "No, it was really close, and we'll just have to wait and see how you do with this." Okay, but if you generate heat close to that pulp with your hand pieces, there's a good chance that that heat could actually burn that pulp up. That's like when you're polishing teeth with a rubber cup. You don't want to hold it on there because you're going to burn the pulp up. So you go on and off and you change the location. You overlap where you just went on and off so that you're not holding direct heat on that tooth. Okay. I just throw that in there.
she was talking.
Okay, so now we're ready. The next step
I did
is
at first, but then it
going
was
to
too.
be placing a
I was trying to get it
mylar
like just right.
And this is the way. I always take my mylar strip. It's going to separate that tooth from that tooth. Well, this is not an MO. Okay. Okay. You don't have to tell me. This is an occlusal only. This one over here, Smarty, that I did a while ago was an MO. Okay, so if it's just an occlusal, I don't have to put a strip in there. But the strip is to separate the teeth so that none of my material or the filling material gets on the next tooth. That's just an occlusal. So we got our Dical in there. The next step is the acid etch. It's a big bubble. Have y'all y'all know about the acid etch yet? Okay, it's a conditioner, and it's going to prepare the tooth, the inside of the tooth, so that our filling material will stick in there. And when you acid etch, that's the one. When you acid etch it, I got a job. I lost one person. Okay. I know who's around. Down inside, I'm going to have to draw this like this. This is looking down in the tooth. Nothing but the tooth. Y'all get that later. Inside here is where this acid etch is going to go. It's acid. It's phosphoric acid, 37%. It's acid. It's going to go in here, and it's going to actually make little pits inside this tooth. It's going to, like, I haven't say eat it. What are you laughing about? Yeah. Look, when that drill is drilling and it's drilling enamel, you know, if you drilled a hole in this wall right here, where's that sheetrock going to go?
In it, in the wall.
Where else?
In the wall and in the installation. The floor.
On the floor. Okay? Right?
Ain't got no
No, you talking about them switches?
This is just like a tooth. This is the floor of the tooth. the inside floor, these are the walls. So we're drilling all that sheetrock, not really sheetrock, tooth structure, it's gonna go in the floor. And that is called smear layer. You'll learn that later. So this acid edge is gonna, we've rinsed and dried it, but it'll prepare the inside of this and it'll make like little pits in it. Okay? Into here. These are called tubulars. Like this. Y'all learn that later. It's gonna get all of this ready. And then it's gonna get rinsed and dried. Okay? And when you dry it, this is important. When you look in there, it's going to have a frosty appearance. Okay, y'all remember that's going to be a test question later on. Frosty appearance. It's going to be frosty in there. Snowman. No saliva can get in this now, from now on, because it will mess it up and we have to start all over again. If saliva gets in there and contaminates that, because right now it's clean, it's decontaminated, everything's out of there, it's ready to go. All right, now, smear layer. It's like solid. Okay, we're going to put, we've acid etched it, rinsed it, we're going to put bonding. Oh, no, I'm sorry. We're going to acid etch. I want you to hand it just like you did your better. This hand.
Because this is supposed to be my passing and I'm supposed
I'm not passing it yet.
I know, I'm just saying, why do I use this one if I?
Because my hand's right here at this angle. If you hold it here, I'm gonna have to turn my arm around. Okay, let's try. But I want here, because I need to push it. Bottom, yeah, lay here. Just like that. See that angle? And that way it's down, and I go straight here and put it in. And then you can take it with either hand if that's how you choose it. So I'm going to squirt that in here. Most of our acid etch is a blue. This is a purple. I see it. This is very bitter stuff. Trust me, I've tasted it. I know. Because somebody said, well, how do you know it's bitter? And I'm going to come back and say, because I've had it in my mouth before. I know. Y'all want some? I'm going to pass it back to you. Some doctors like to use these little micro brushes, and you can bend them. Some of them are called bender brushes. These just happen to be called micro brushes. You can bend it, and they like to actually put that in there. And I'm gonna tell y'all a little secret, and you don't know that. You got this on video? You don't know this. Listen, that's very delicate in there right now. All those little pits, and if you take something like this and you really rub it in here. It's like these little pits like that. You done cut them off. A very experienced dentist taught me that. If y'all work for an older dentist, you should know that. But do y'all follow me? If you rub it really hard, all these little areas here are just going to get knocked off. Then it's going to be just solid again. So we want those little, because we want the filling material to go in here to stick, help stick. So here. So. Okay, now the next thing she's going to do, the acid edge has to stay on there about 20 seconds. I want the suction. Air, water, suction. You take your suction and you're going to come over it and suck up the majority of this instead of trying to rinse all that. Because if you rinse it right now, there's a good chance you're going to wash it right down your throat or in your mouth. They're going to start salivating because it's bitter. And then all that saliva is going to go back over into our tooth. We got to start all over again. So you suck up the majority, okay, and then you just roll it over and rinse it and dry it.
Do you rinse it?
Yeah. You got to rinse it out of it. You don't rinse the bonding out. So right in the tooth. Okay. Now we're gonna get ready. We're gonna put our bonding material in there. So it's acid etch, rinse, dry, bonding, cure it with light. Okay. So I don't do that. I use a brush to get it down in there. That's not the same one we had with acid. Bonding material gets in there, and then they'll take their air. Miss Boynton, are you watching this so I don't have to teach this again? Look, you know, if you think about this, you see that little spot right there? That's play light, that's bonding material. Let's play light. Girls. That it pulls up and makes a little pool, right? The doctor will take air and spread it out like this. See, he spreads it out in the floor of that press. So it's not a pool. If it's a bubble, it may have a void underneath of it. So he wants to spread it out in there. Okay, and then the next thing we're going to do is cure it with a light.
Make sure y'all don't look at the light.
If you look at the light, you'll multiply, and we don't need a funky doll. Okay. Now, let me show something. When you're doing this and you're holding it here, you have to look away from the light. Most of the time, your arm is just going to drift. See how it's drifting? Because I'm not watching it. You can't look at the light. And I look down, I'm way out here. So if you'll take it, make a fulcrum, and then steady that light with your thumb like you're shooting pool. You can turn away and it'll stay right there. I've done that before when I first started doing it. And I look up and look back, and I'm shining it right in their cheek or their ear. It's just drifted away. So I always steady like that. Okay, so now we're going to put our filling materials in. Again, the hand is done. Yeah, it's ready material. See how I do that? I steady my hand. Place this composite material in. Do all the hand is flowable? Not like so small. Y'all will learn these instruments. This is a plastic instrument. See, she's going to wipe the excess off. And what I'm doing is shaping it in there. Okay, and I'm going to hand her this back, and then she's going to grab the curing light. This. Y'all, look at this is the composite material. Can y'all see that? Yes. See it? Y'all see this composite material? See how runny it is? This is called flowable. Okay, now you place it in there, you get it all in here where it needs to go, and then cure it with the light. Cure this one. Don't look at the light. This will burn the retinas in your eyes. Okay, seriously. Don't get tempted to look, because you'll be seeing blue dots. Okay. Now look at it. It's hard. See that? So it gets in there, we're in the little nooks and crannies all in here. And then you hit it with the light. You don't actually hit it, but the doctor will say, hit it. You're going to hit it. Hit it. That's what it means, is turn the light on. See that? Hit it. Hard. Okay, what she's doing is, I'm going to use this high-speed football finishing. This is a football finishing bird. See, it's shaped like a football. Look at it and kind of use your imagination. Okay. What she did is she went ahead and put a sandpaper disc on here so I can use it to smooth it, but I'm going to use this one first. Put a little anatomy in here. I'll make it look like a real fish. Articulating paper. Okay. So what she's gonna do, now you see how she held this in her hand, the air, water, and suction? Because this just takes a second. Okay, slowly back down. I'm checking to see if there's too much filling material in there. I'm checking the bite. Tap, tap, tap. It looks good. It's on that buccal cusp where it's supposed to be. Because these buccal cusps actually fit on the occlusal of the upper teeth. See? So that's normal. So that looks good. This time I'm going to have them tap, tap, tap. Keep your teeth together and slide them side to side. That's going to check the incline. But it may be fine doing it this way, but when they're chewing, it's like they hit it all the time. So we're going to check to make sure it looks good. So now we would polish it. You can use a sandpaper disc, or we might use one of these little burrs here, little rubber wheel. Oh, I'm not gonna do that.
Okay, so these sandpaper discs,
They go from coarse to fine. This goes backwards or forward. So as we get done, he checks the bite and he'll come back with whatever they use. They use different things to polish it, okay, to make sure it won't be rough. Okay? And he said, hey Bob, be careful, you're gonna be numb up there for an hour or so don't bite your lip. If it's a child, I got the parent in here, I'm gonna say, now look, see, you have to be careful and don't bite your lip. See, nothing you haven't bitten this here, so be careful. Because as soon as they get in the car, I just showed the parent, they're not bleeding. As soon as they get in the car in the back seat, they're gonna sit down and go. And then they're gonna go, all this blood, they go, Mommy, I'm bleeding. And she's driving, she's going, oh my God, they cut him up. And turn back around and come back in there, you cut my child up. No, we didn't. Remember, I showed you with the mirror. I'm telling you, it's only have oral surgery. They don't bite on that gauze, and they get home and there's blood all over them. Yeah, okay. Okay, Bob. We'll see you next time.